Republicans today fought back against the Democrats' domination of the health care legislative process. Democrats have accused Republicans of not taking part in the process, but Republicans have said they have participated. In fact, they proposed alternate bills and hundreds of amendments, most of which have been killed by the Democratic leadership. Lisa Sylvester has our report.
For months, Republicans have been attacking Democratic health care proposals, and Democrats have criticized the GOP for offering no reform plan of its own.
What's your answer? What's your solution?
Republicans have no plan to fix it. They have no plan to protect consumers.
But Republicans say they have offered legislation that would, among other things, let small businesses pool their resources to lower the cost of insurance, allow Americans to purchase insurance across state lines, permit individuals to take a tax deduction for health insurance premiums, and set up special tribunals for malpractice cases in an effort to prevent frivolous lawsuits against doctors.
Instead of 1,000-page bills and changing the whole system, and adding to the debt and cutting Medicare and raising premiums for millions of Americans, we'd like to say our goal is to reduce cost.
A spokesman for House Speaker Nancy Pelosi fired back, saying Republicans have decided they want to be the party of no and have offered skimpy outlines rather than comprehensive reform, with no assessment of what their proposals would cost. But according to the Republican Study Committee, 40 health care bills have been introduced by House Republicans since January, but the bills haven't been taken up in the democratically controlled Congress.
Virtually none of them have been considered in committee, and that's because, at least on the House side, there's not a bipartisan effort at all by the Speaker of the House.
It hasn't been much different on the Senate side. Most of the Republican amendments to Senator Max Baucus's bill in the Finance Committee were defeated in party line votes. Representative Price, who is also a medical doctor, says each week for the last 10 months he has tried to meet with administration officials to offer his ideas on health care. But after being repeatedly but politely ignored, he finally had a meeting with Health Secretary Kathleen Sebelius yesterday, which he called, quote, a constructive exercise in bipartisan discussion. The White House says the president has been working with Democrats and Republicans and will continue to do so. Lou?
It's remarkable. They really do talk like they, don't they? A constructive exercise and bipartisan. I love it. Thanks very much, Lisa. Lisa Sylvester.